Well, hello everybody. It's great to be with you all today. My name is Jacqui and I'm a geriatrician working at the Prince of Wales Hospital in Sydney. I also undertake research at Neuroscience Research Australia. My research interest is falls and injury prevention and management. I've spent the last 20 years of my life looking after people who've been unfortunate enough to break their hip, and today I'm going to tell you a little bit about hip fractures, but also try and assure you that there are things you can do to ensure that you're not one of those statistics for the future. Here's a stark reality. In Australia in 2013, there was one fracture every 3.6 minutes, and that equates to 396 fractures per day, or 2,760 fractures a week in Australia. That number is set to increase for the foreseeable future. So by 2022, there'll be one fracture every 2.9 minutes in Australia, 501 fractures a day, 3,521 fractures per week. Those figures are stark. We're not the only country with problems. This is the US, and this is their 2 Million Too Many campaign. And this picture here shows you what they call Cast Mountain. And what Cast Mountain actually represents are the 5,500 bones that break in the US every single day from osteoporosis. So these are the casts from people's limbs that have been discarded. And yet in the US, only 2 in 10 of those individuals actually get followed up for osteoporosis, and the figures in this country are not much better. If we focus specifically on hip fracture, so in Australia, there's about 60 hip fractures a day in Australia, and of those 60 people who come through the doors of our hospitals, about 50% of them will have had a previous fracture. Yet most of them will not have been offered treatment for osteoporosis. The consequences of a hip fracture are significant for the individual who is unfortunate enough to sustain the fracture. 50% of those individuals don't ever return to their previous level of function. 25% of them are dead at a year, and that figure is higher if they come from residential aged care or they're cognitively impaired. 10% of people who fracture their hip who originally lived in the community end up in residential aged care, and people with dementia do particularly badly after hip fracture. So in this country, we have guidelines which are based on the evidence that tell us how we should be practicing. We have standards that have been developed that tell us exactly what we should be doing, and we have measurements to allow us to see how we're practicing against those standards. So I'm fortunate enough to co-chair the Australia-New Zealand Hip Fracture Registry with Ian Harris, and that registry is based here at Neuroscience Research Australia. And that registry is set up to actually track how we're performing in terms of delivering hip fracture care in Australia and New Zealand. These are the hip fracture clinical care standards. These are produced by the Australian Commission for Safety and Quality in Healthcare. And there's nothing terribly contentious about these standards. It talks about the amount of time you spend in the emergency department, the importance of analgesia, so rapid access to pain control for somebody who's had a hip fracture, making sure that the model of care is designed to deliver for the care needs of that individual. Time to surgery is an incredibly important marker of performance, and certainly we do not want people lying in beds in pain, fasted, immobilized, waiting for prolonged periods for surgery. After they've had the surgery, we're very keen to get people out of bed and back up on their feet as early as possible to give them every opportunity to return home. Secondary fracture prevention, we're talking about osteoporosis and making sure that when people leave the hospital setting that they're empowered to take control of future falls and fracture prevention. So if we think about the hip fracture population and we look at the 2017 report for the hip fracture registry, the average age of your hip fracture patient is 82 years of age. 70% of them are female. 71% come from home. 62% have no history of cognitive impairment. But that also means that 38% of them do have underlying cognitive problems prior to admission to hospital. And 47% of them didn't require any walking aid prior to admission to hospital. So this is a graph really, or a table, that just shows you how we pull together the guidelines, the standards, the indicators and the registry. So the guideline tells us to perform surgery on the day of or day after presentation to hospital with a hip fracture. The standard for this country is a patient presenting to hospital with a hip fracture or sustaining a hip fracture in hospital should receive their surgery within 48 hours if there's no clinical contraindication and assuming the patient wants the surgery. We measure that by the proportion of people undergoing surgery within 48 hours, and we record that through the registry and report back to all the hospitals across Australia. Put even more simply, for a hip fracture patient, the sun should never set twice. Now this graph is a little bit complex, but stay with me. This is a list of hospitals de-identified, and this is telling us the average time to surgery by hospital. It also shows you the Australian and New Zealand averages. So for 2016, the average time to surgery in Australia was about 54 hours. It was a little bit less in New Zealand. But you can also see with the individual hospitals that there is a lot of variability, where some hospitals are clearly able to get patients to theatres much quicker than others. And there will be a multitude of reasons why that should be. Sometimes the patients are not ready for surgery and just need a little bit more time to become medically stable. But there are clearly issues between hospitals in terms of access to operating theatre time. And that's something that we can and should be doing something about. If you have a hip fracture, there's a range of different surgeries that are suitable for your particular fracture type. On the left, you can see a sliding hip screw. In the middle is a nail. And on the right, we've got a hip replacement. Again, this slide or this graph shows variation in the way we're practicing in relation to giving the patient the opportunity to mobilise the day after surgery. So there are a number of hospitals in Australia where everybody is given the opportunity to get up and get out of bed the day after surgery. But there are other hospitals where that opportunity is given to as little as 50% of those individuals. Now again, there will be a range of reasons why that might be so. And some of it will relate to the availability of therapy services, particularly at weekends. We've talked about osteoporosis and the importance of osteoporosis and bone health in relation to fracture prevention. This particular slide shows that of hip fracture patients leaving hospital in Australia, only 16% actually leave hospital on a proper treatment for osteoporosis. Now that's a very poor figure indeed. So when we're talking about reducing your risk of fracture, we're talking about falls prevention, and you'll have already heard about falls prevention, but bone health is an equally important thing to consider. Vitamin D is an essential building block for bones. It's also important in terms of falls prevention, and most of us get our vitamin D from the sun. As you get older and your skin gets thinner, your ability to synthesize vitamin D in the skin diminishes. And certainly if you have sunblock on, again, your ability to synthesize vitamin D is diminished. But ideally, we all need about 1,000 international units per day of vitamin D. And if we can't get it from the sun, it's very easy to get it either in a liquid form, a gel capsule form, or you can even get the Vita gummies, which are extremely tasty, and one of those a day is sufficient. Calcium is the other basic building block in the bone, and most of us get our calcium from dairy products in the diet. But there are a number of other green vegetables that also contain reasonable amounts of calcium. But the reality is about 50% of Australians don't get enough calcium in their diet. So again, it is possible to supplement calcium if we cannot get enough in the diet. If you are worried about osteoporosis, and if some of you have had broken bones in the past and haven't been assessed for osteoporosis, then encourage your GP or talk to your GP to see whether you could have a bone mineral density scan. It's a very simple scan, takes about 15 minutes to do. It's not uncomfortable, it's not painful, and the results are available very quickly. And if you do have osteoporosis, again, there are a number of treatments that we have that have been available for decades now. You can have tablets that you take once a week, tablets that could be taken once a month. You can have an injection from your GP once every 6 months, or you can have an injection through a vein, which is often administered in the hospital setting once a year. There's a range of options that people can choose from. So whilst I've given you some fairly scary statistics, and it is true, fractures are common and hip fracture is a devastating injury in an older person, it is possible for us all to look after our bones. Make sure that the calcium in our diet is sufficient, that if we're not getting enough sunlight or we choose not to be exposed to sunlight, that we supplement our diets for vitamin D. Avoid falls with all the usual strategies that you've heard about, and if you have had a fracture, please get your bones assessed. Thank you very much.